Can a probiotic help with autism? What about this new strain, PS128? Can it help my child with behaviors? Hi, everyone. It's Dr. Tidman. Thank you for stopping by my channel. Remember that these research presentations are for informational and educational purposes only, so consult your own physician if you want to make changes. So today I'm going to introduce the subject of plantarum, PS128. Earlier on my channel, I posted a research review on the use of this probiotic in Parkinson's disease. And after that video posted, I had a comment left that said, "What about using this strain in autism?" So I did some research and am posting this review on the use of PS128 probiotic in autism. So I hope this proves useful to you. So remember to leave a comment. I read the comments and I try to respond to each of them. So autism, or Autism Spectrum Disorder, ASD, is defined as a specific neurodevelopmental condition characterized by some basic symptoms. These include deficits in social communication and interactions, restricted and repetitive patterns of behavior or repetitive movements, and limited social activities, limited attention span, and some significant behaviors. The research is really booming in the area of the gut-brain axis in many neurodevelopmental and neurodegenerative diseases and in ASD. People with ASD show a high degree of gastrointestinal problems. We know that these patients have altered gut microbiota. And there's some different studies that investigate, can we affect the gut microbiome, and will that affect the behaviors we see in ASD? And this article I'm reviewing is one of those studies. According to animal models, PS128 can modulate the level of neurotransmitters in the brain, and we know this has been investigated widely in Parkinson's disease. And we know that in ASD, these neurotransmitters are disrupted or malfunctioning in some way. So this study by Liu et al. Investigated a 4-week randomized controlled double-blind placebo trial. So what is that? Randomized means they randomly selected participants to be in one group or the other group. There was really no rhyme or reason to it. They just randomly assigned the participants to these groups. Double blind means that neither the participants nor the researchers knew if the participants were in the probiotic group or in the placebo group. They investigated the use of plantarum PS128 on boys with ASD ages 7 to 15 in Taiwan. So this is a specific population. They used questionnaires for their outcomes measures, and these are commonly used in autism. The Autism Behavior Checklist, the Social Responsiveness Scale, the Child Behavior Checklist, and the SNAP, which is an inventory or questionnaire of parental observations of their child's behavior. And then the Clinical Global Impressions Improvement Scale, which is used for a variety of disease conditions. So again, they only tested boys. Boys have a higher incidence of ASD. The boys were between 7 and 15 years old. The trial only lasted 28 days with a daily intake of this PS 128 in the probiotic group. There were 39 subjects enrolled in the probiotic group initially, and then they had a placebo group where 41 subjects were randomized. At the end of the study, the probiotic group had 36 subjects, so they had 3 subjects drop out for various reasons, and the placebo group had 35 subjects, so 6 subjects dropped out of that group. Now, the placebo group also consumed a daily tablet that was identical in every way, taste and appearance, to the probiotic tablet. So once again, neither the participants or the researchers knew which children were in which group. Double-blind, randomized, controlled trials are really the highest level of evidence. In the probiotic group, the children consumed a tablet that had 3 billion CFUs, that's colony formulating units. This is how probiotics are measured. And then, of course, the placebo group got their capsule every day too. So results. The results showed that PS 128 really helped mitigate some of the symptoms of opposition and defiance. So these are behaviors that are demonstrated by children with ASD. This was reported on the SNAP, and remember, the SNAP is a tool that is parental observations of behaviors, opposition, defiance, and these children that were in the age group 7 to 12 years seem to improve more on these behaviors on this SNAP scale with the PS 128 taken daily and compared to the placebo group, who didn't see any improvements in these symptoms. So again, the SNAP is a 26-item questionnaire filled out by the parents that reflects symptoms of ADHD, which are commonly seen in children with ASD, and then the oppositional defiance behaviors. The other scales they tested didn't show any difference or significance when they compared the PS 128 group to the placebo group. So the results showed that there was an overall statistically significant reduction in hyperactivity and impulsivity and opposition and defiance over the 4 weeks in the probiotic group. These changes were not seen in the placebo group. Of course, the observation was taken from the parents filling out this SNAP questionnaire. And what this showed is PS 128 may be beneficial for improving the ADHD related symptoms in ASD, Autism Spectrum Disorder, some of the hyperactivity and impulsive behaviors, and then the opposition and defiance behaviors. So that's what the parents reported. Remember, this was only 4 weeks of taking the probiotic every day, and the placebo group took a similar identical capsule every day. And then they compared the results on this SNAP questionnaire that the parents filled out. Remember, nobody knew what the child was on. So It was very well controlled. I think the study had a good design, but I'll talk about some of the limitations in a minute. And here they are. So 4 weeks is a bit short to see some real changes in the gut microbiome. Remember that one of the functions of these probiotics is to take up residence in the gut and begin to build colonies. And so this takes time. And I wonder if they would have seen more significant results if the study was a little longer. We also know one of the problems in ASD is children suffer from a variety of symptoms. You can have children who are very oppositional and defiant, but then children who are more withdrawn socially and more isolating. Lactobacillus plantarum PS128 strain is a psychobiotic. Now, what is that? So, psychobiotics is a brand new rising area in research. They are probiotics that have a psychological or psychiatric function. So, they function really closely with brain neurotransmitters and neurochemicals, and they really do influence brain chemistry. There's a whole area of research in the use of psychobiotics in neurodegenerative, neurodevelopmental, and mental health conditions. So this is a rising area of research. So this particular study showed that the PS128 daily for 4 weeks could have a positive effect on the disruptive, rule-breaking, oppositional defiant, and hyperactive behaviors in these boys, specifically the younger group between 7 and 12 years old. They did not find as significant a result in the boys that were 13 to 15 years of age. So the effects seem to be age dependent. But remember, this was not a large sample size. They ended up with about 36 or so children in the probiotic group. And remember, these children were Taiwanese. So take into consideration the population that was used in this study. The authors did suggest that early intervention with the use of probiotics may have a more positive effect. So what are my tips and takeaways? As always, I think you should try a low-carb ketogenic diet with your child who has ASD. Remember that to elevate ketones, which are very beneficial for the brain, you might want to try an intermittent fasting regimen for your child. There's no reason they should have snacks between meals, and there's really no reason, unless they're dramatically underweight, for them to have to eat more than 2 meals a day. So as long as they're getting adequate nutrition, you could try a fasting regimen. In children, I don't recommend the 1 meal a day option, unless, together with their ASD, they happen to have an epilepsy diagnosis, and then you really need to look towards the epilepsy diet. Now, how are you going to know what your child's level of ketones are? Well, you won't know unless you test. And yeah, testing a child with ASD every day using a finger prick and a meter, that may be challenging. But if you can accomplish it, you will be able to see what their blood ketone levels are. And as these levels rise, I wonder if you'll get a behavior improvement. Add daily MCT oil. This is a surefire way to elevate their ketones, whether you're able to test them or not. And then try probiotic therapy. There are some probiotics that have been recognized as having some benefit. These include L. reuteri, L. coagulans, L. gasseri, and of course L. plantarum. These probiotics can be fermented into a fermented dairy, which is more like a yogurt, at home. So check out my channel for the video entitled Probiotics and the Gut Microbiome. In that video, I talk about the benefits of these probiotics and how to make fermented dairy at home that turns out like yogurt. And your child may eat yogurt where they may not swallow a tablet. Plus, the yogurt you ferment with these probiotics turns out to be quadruple the amount of CFUs, or colony forming units, which can have a more profound effect. You also can ferment each of these strains separately and experiment on how they affect your child's symptoms and behaviors. This is the reference for the Liu et al. Article that they published on these probiotics, L. plantarum and autism. This study was conducted in 2019. So thank you for stopping by and viewing this video on L. plantarum and autism. And thank you to the person who posted the comment. That caused me to go out and look at the research, and I love it when you leave comments, so keep them coming. And I will see you all in the next video.